the investigation into dozens of deaths at an NHS trust, codenamed Operation Bramber, is intensifying, with police now examining potential charges of corporate and individual manslaughter. This revelation follows mounting pressure from bereaved families who are demanding the resignation of the executive team, citing alleged negligence and a systematic cover-up spanning from 2015 to 2021. Initially focused on a smaller number of cases, the scope of Operation Bramber has expanded significantly, now encompassing approximately 200 reported incidents. The investigation's broadening reach is evident in the recent notification to the family of a man who died last year. Police informed the family that their loved one's death will be included in the investigation due to alleged failures in his care dating back to around 2019, highlighting the protracted and pervasive nature of the alleged negligence. The trust, which operates hospitals across Sussex, including prominent facilities in Brighton and Worthing, has been the subject of intense scrutiny in recent times. A cascade of damning inspection reports has exposed significant systemic failures within the organization. Further compounding the concerns, the trust consistently held the unenviable distinction of having the highest number of patients in England enduring waits exceeding 18 months for essential care. This alarming statistic, coupled with its recent ranking among the 5 worst-performing NHS trusts in England, paints a stark picture of widespread organizational dysfunction and a critical lack of patient care. Adding to the already significant concerns are the disturbing allegations emerging from a Facebook group comprising 85 families. These families, united by their shared experiences of the alleged medical negligence at the trust, have issued a collective call for the immediate resignation of the entire leadership team. Their demands are underpinned by a series of deeply troubling incidents brought to light, each illustrating a pattern of alleged misconduct and a culture that appears to have tolerated, if not actively enabled, such behavior. Among the most alarming accusations are allegations against a surgeon accused of assaulting 2 registrars during surgical procedures. The severity of this allegation cannot be overstated, representing a gross breach of professional conduct and a potential risk to patient safety. Further compounding the concerns is the reported use of a Swiss Army penknife during an operation by another surgeon, a shocking instance of improper equipment use that raises serious questions about the trust's commitment to maintaining the highest standards of surgical practice and patient well-being. These individual incidents are not isolated occurrences, but rather appear to be symptomatic of a broader, more systemic problem. A Royal College of Surgeons report further corroborates the family's claims, highlighting a deeply concerning culture of bullying and a pervasive culture of fear within the trust. This finding underscores the systemic nature of the alleged issues, suggesting a failure of leadership to address and rectify long-standing problems, ultimately contributing to the alleged medical negligence and the tragic loss of life. The findings of this report, along with the accumulating evidence of alleged negligence and cover-up, paint a picture of a deeply troubled institution that has prioritized institutional self-preservation over patient care and safety, a failure with potentially devastating consequences for countless individuals and families. The scale of this crisis necessitates a thorough and transparent investigation to ensure accountability and to prevent similar tragedies from occurring in. The family's plea for the resignation of the leadership team reflects a growing demand for fundamental change within the trust, a change that is crucial for restoring public confidence and ensuring the provision of safe and effective healthcare services. The ongoing police investigation is not just about assigning blame. It's about uncovering the systemic failures that led to these alleged preventable deaths and ensuring that such negligence is never again permitted to flourish within.